A review paper was recently published titled Sodium Restriction and Insulin Resistance, a review of 23 clinical trials. And if you read this paper, you'd probably come away with the idea that if you try to eat a low sodium diet, you'd become more insulin resistant. However, as is often the case, things aren't always as they seem, particularly when the author of said review paper also has a book called The Salt Fix, encouraging you to eat as much salt as you want. In fact, this review paper is simply 23 cherry-picked studies taken out of context of the totality of the literature. A review topic from 2016 tells us what we need to know. The beginning periods of a sodium-restricted diet, the first weeks, you do see an increase in insulin resistance, which doesn't typically change your A1C at all. But over the long term, 4 weeks or more, you actually see improvements in insulin sensitivity. This is not mentioned in Dr. James Denick's review paper. Furthermore, most of the studies he references are 7 days or less. And the only study that is long-term, 12 weeks, was actually replicated twice by the same authors, and the results were not upheld. So this idea that a sodium-restricted diet will increase insulin resistance over the long term is a nothing burger.